Welcome to MedAxiom HeartTalk, where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
I'm Melanie Lawson, host of MedAxiom HeartTalk, and today we are taking an in-depth exploration of modern strategies to streamline cardiovascular care delivery. Joining us today, we have Dr. Jaime Murillo, SVP and CMO, UnitedHealth Group. Thanks so much for talking with us today.
No, it's my pleasure. Thank you for having me.
Well, you had a simple saying that I heard you say: change is simplification and simplification is change. What does that mean to you?
Yeah, it's a journey that many of us have embarked upon, where we're simply thinking we've made such a mess of healthcare that we don't need to create another similar model of healthcare. We just need to simplify it. And we need to simplify thinking of the people who need care. We have for decades been tweaking models of care based on the convenience of the doctors, the healthcare systems, and so on, but not really thinking about the people who actually need that. So if we just imagine, if you ask someone in the street, or I always like to say a kindergartner, and you ask them, how do you provide care today? They'll give you the simplest answer. That's exactly where we need to arrive. It sounds simple to get there. It's going to be very complicated, but at the same time, it will be better for everyone.
And patients are really demanding that. They want their healthcare to be as convenient as possible. Yes,
for decades, we, the doctors, always had the privilege of being the ones who dictated, that sounds strong, but that told people what to do. Mm-hmm. It was very unidirectional. So to your point, as people are now becoming, newer generations becoming our patients, the dynamic changes where they are entitled to say, hey, these are my preferences, these are my needs, can you give me your expert advice on how to do it, and then we'll work together. So it's more of a bi-directional approach, which the advantages are that if you convince someone that that's the right thing to do, then there will be more adhering to the plan, take more medications, and ideally get better sooner and prevent adverse outcomes, because ultimately that concept of simplification means also going upstream so we can prevent adverse outcomes.
Yeah, and ultimately that's what you want, patient-centered, and the patient to get better and not have to see you again. So let's talk about some of the main pillars of simplification that practices can focus on.
Yeah, so today we still having trouble getting people access to care. We're still having difficulties with the number of providers or doctors and APCs and specialists that are trying to get people in their offices. It's because we have not changed the model. So the concept of simplification simply means one is work as a team. Don't depend on a single doctor doing every single piece of it. So I always tell the providers, think of you as the mastermind of that plan. You build a plan, and then someone else executes on those tasks that you assign to that plan. So imagine if a doctor were able to see every single person who has a complex problem, formulate a plan, and then have a team of dedicated people who are really being the ancillary enablers of that plan. So that's that team-based care concept. The other concept is we are in the 21st century. We have a ton of technology. There's still more to come. There's AI in the midst, although we have to be very mindful that AI is still not quite where it needs to be, but nonetheless, for the future, it's a tool that we can use. So use technology, embrace technology. We're no longer practicing an environment where it's technology free, and also it's a way to reach people. The other concept is how much of that care can be provided at home. Think about how healthcare is behind other industries.
Right.
Other industries evolved to the banking, hospitality, airlines. Now you can do a lot of those transactions at home. How much of healthcare can you do at home today? Very little. Can we start thinking in those terms, where people can actually do a lot of healthcare things, not necessarily complex things, but really tasks that they, instead of coming to the office or the hospital, they actually could do at home. So can we provide it at home, especially having technology that will allow us to connect with them. And then the last piece is what I call, what we all know is value-based care, which is what is the right incentive for us to take care of people? Is in treating people when they have a stroke of a heart attack, or is actually preventing them from having that stroke and heart attack? So the incentive should move in that direction, where there's an incentive to do better for people, but there's also, on the pragmatic side, you have a financial incentive to do the right thing.
Right. Yeah. Those are great pillars, and certainly I love the buy-in concept. If everybody's on the same team and then they're assigned something they can execute. What are some of the ways that these organizations can really achieve those pillars?
The one is embracing the concept of value-based care, because fee-for-service is very tempting. As a cardiologist, I can tell it's easy to read a test, do a procedure, see a patient in the office, because you're billing every single time for that service. But at the end, it doesn't lead to better outcomes. It just is doing the same thing every day. So embrace value-based care, where it's not about how many services you can provide on a daily basis. Is, as I like to say, when you see a patient in front of you, can you think of, how can I make sure that this patient is better 6 months or 12 months from now? Then you build that plan toward that person being better health, as opposed to what's the test that I need to order today, and then the next visit and so on. That's a very transactional, so moving more for the transactional experience. Everybody does it because they want to help. Don't take me wrong. Doctors are motivated to help people, but the current environment doesn't incentivize that long-term thinking, because there's a level of uncertainty in that long-term thinking. If we provide an environment that brings more security to a long-term plan, that's going to be a motivation for them to think in the long term.
Yeah, and you talk about the higher purpose.
Higher purpose, yes. We are all driven by a mission. And I truly believe that every single person in healthcare space is driven by that mission to help others. It's just a very common trait that we all share. Whether it's because we feel passionate, very often is someone had a condition in their families that motivated them to do that, or someone grew up in an environment where helping others was important. So that mission remains still the key pillar of every motivation for us to do better. And then around that inner drive, that motivation, the higher purpose, then you set up the right conditions that we just talked about: technology, extended care, value-based care environment, and I think that will satisfy everyone.
So what role do you see cardiologists truly playing in the future as it relates to primary care? You actually said you're very optimistic about the future.
Yes, it's time for us to partner with others. Cardiologists have been in an environment where our expertise is so needed, so essential. We do so much good for people that we have dedicated our lives to do that, but have not really worked in an environment where there's collaboration, coordination. And it's not, I'm not talking black and white. There are many people who really have that coordinated care, people who will work with others, and that's usually the usual, but not in a structured way. So my point is about establishing true partnerships with primary care, for instance, with other organizations. I talk about community organizations as well, and establishing a partnership where you can bring the patients or the people who need your expert help, and then delegate other types of help that either the primary cares can provide, or even in the community, utilizing community health workers, the nurses, the pharmacists, the social workers. They all play a role, but we have not made good use because we have this tendency to believe that we should be doing everything.
Yeah, I heard you say that, that cardiologists are not responsible for everything. And to truly work to that higher purpose, you have to use all the tools in the toolbox.
Correct.
Yeah. All right, Dr. Jaime Murillo, thank you so much for talking with us on Heart Talk. Great perspective. Remember, change is simplification, and simplification is change. Thank you so much.